Good morning, everybody. Simon said, yes, I'm a West Brom fan, and I'm Director of Commissioning and Joint Commissioning in Birmingham. The stuff that Alison was saying about joined up kind of working, I think, I've been in social care for about the last 25 years, and I think we've always talked about integration and working together, but never quite felt we've got there. I'm not saying we've got it right in Birmingham, but we've actually kind of taken some fairly big strides towards kind of bringing together the health and social care system, including housing, etc., kind of to work much more closely together. About 4 years ago, we actually set up a pooled budget around learning disabilities and mental health services for £300 million, and that's kind of still in place, still working well, fairly informal rather than formal, and we've seen some real progress around that. And with a Better Care Fund, we're talking in Birmingham, somewhere in the region for older people, about 600 million going into the pool and actually being worked kind of across health and social care for the betterment of individuals. But what I want to talk about this morning, hopefully, what I want to talk about this morning is the work that we've done in Birmingham around telecare and telehealth. We're rather more advanced in telecare terms. We set up a contract, a fairly innovative contract, about 3 years ago with Tunstall to look at kind of enabling, supporting individuals in their own home. And that kicked off originally as an enablement kind of approach. It's all about prevention. But of course, as Alison quite rightly said, budget and money is very tight these days. And we look to actually kind of apply the same principles into some fairly complex care packages, particularly for people with learning disabilities. And we've seen some fairly significant savings. So the kick-off point, the City Council, with full support of the Cabinet, committed to spend somewhere in the region of 14 million in total around telecare. To date, we've spent about 7 million and seen some fairly significant developments. So why reform? We talked about the fact that kind of money was tight. We also in Birmingham have developed what we call the kind of peace of mind bond for older people, which is about giving them a bit more security, a bit more confidence about living independently and feeling that they've actually got something to fall back on, they've got someone to talk to in times of need. The other bit about the programme is that affordability was always potentially going to be an issue, and we didn't want that, so we actually kind of developed this programme on the basis of it being free, so people actually get this service on the basis of it being a free service. The need in Birmingham is pretty obvious, I won't say too much about it. Population of over 1 million, significant increase in the over 65 population, diabetes quite a significant issue compared to the rest of the country, and also hospital admissions, falls, etc., rather higher than the national average. My boss, Peter Hay, Strategic Director of People now, we've seen some changes again around the way that we're organised. We have less strategic directors, but what we've tried to do is bring together the whole of the People Directorate. So that includes children, so it's kind of a cradle-to-grave service. And just like that citizens' kind of journey, we did a lot of transformation starting about 5 or 6 years ago, looking at that citizens' journey and trying to improve it. And we invested kind of millions of pounds really to kind of improve that journey and improve the services that we delivered. But Peter, kind of a strategic director, is very much into making sure that every kind of encounter people have with social care is a beneficial encounter and improves their lives. Our partnership with Tunstall, I think, is a unique one. It's not just about kind of getting kit into people's homes. It's about developing a service that's got some longevity, a service that people can trust, and also a service that kind of people have confidence in. What I find as a commissioner is the most important ingredient in my role is confidence. And I think the same goes actually for individuals in the community. If you can provide that confidence to people, I think they actually kind of can live in a much more kind of effective way in their community. We've actually kind of managed now to provide services somewhere around 11,000 people. What I would say on top of that is that there's a similar type of service that we currently have in Birmingham that we're looking to integrate that also provides a pendant service only to about 15,000 people. So the service is quite unique because it actually kind of includes the assessment, the installation, the monitoring and the response service. And what we've done in terms of our own system in social care is to enable Tunstall to have reports from that system. Referrals come from the social workers into kind of Tunstall's office. They do the assessment. Lots of training's being done with individuals, both within social care but also within Tunstall. And I think one of the things we learned from the very early days was that you needed to make sure that kind of interaction with the individual, with a citizen, was as kind of comfortable as it could be. And we learnt a lot from the first year of our operation, and I think things are moving much more smoothly now and more effectively. So the unique features, as you'd expect, I mean, they are personalised packages that cover dementia, falls, learning difficulties. I mentioned that earlier. I think we've had a lot of success in terms of reducing, and I think this is what people have been most interested in, how much can we save from the investment. But we've been successful in reducing the size of the package. Again, in the early days, I think the social workers saw telecare as something that was an addition to the normal package of care that people would get. What we had to do was educate and work with people. I think we've trained somewhere over 2,000 people now, both within social care and outside of the organisation, to understand how and what, in terms of telecare, can be actually provided and what's the art of the possible. For example, we've kind of reduced 2,000 plus packages to about £1,000 a week. And in obviously learning disability terms, there's a number of those types of packages, and that is a significant saving. As I mentioned, training and development's been significant, and it's not just the social workers. We've actually worked with the third sector, and again, Alison mentioned the third sector. I mean, we have a kind of a market strategy in Birmingham, a market position statement, which is very much about having a kind of a market mix that's appropriate and can deliver the services. So there's three routes into our service: the assessment, support, planning, social work team, obviously. Prevention, this programme actually kicked off through public health. It was the public health team that actually let the contract originally. It was then passed through into commissioning because clearly there were two dimensions to it. Prevention's really important. I think the care bill's emphasising that. But also we had to kind of look at those very heavy-end packages and what we could possibly do to reduce cost. And obviously we have an enablement team in Birmingham, which is also an important route in. The other bit I think that's important is that the citizen has driven a lot of what we've done. It isn't just about saving money. It is about what's actually best for the citizen. And we actually use the Good Governance Institute to kind of do the work with our carers. They set up a board, and we've had some very effective feedback, both good and bad, but an awful lot of good feedback to emphasise how important this service is to individuals. So in terms of the service itself, you have to be a service user over 18, live at home, need help, or have a physical disability, learning disability, or a mental health difficulty. I've mentioned what we actually kind of deliver and the way into the packages. As I say, kind of, there's been a significant response to this service over the years. 18,500 referrals, 12,000 service users now as it moves upwards, being enabled to stay independent in their own home, which is really important. Number of calls answered, very, very significant, and responses to the emergency services, and getting help to people when they need it. Got a couple of people who kind of very happy to share their stories, who have had their lives transformed. And again, for me, it's not just about saving £4 for every one you invest or whatever the number might be, but it's all about what difference has it made to the citizen's life. And Gerald's story, I mean, he's got a really difficult kind of situation back home, and as a carer, he needs a lot of support. Evelyn's story, very similar. This is a lady that's got a lot of difficulties, and she sees the telecare service as something that's almost kind of helping her kind of be connected to the community still. And then finally, Louis' story. Louis was very honest, and I think he's been very public about the fact that he's been through some very difficult personal times and has been at the edge of kind of, desperation. And again, the service has helped to support him in that sense and actually kind of give him the help when he needs it. User satisfaction, I think this for me is really quite awesome. 99% of service users rate the service as excellent or good. I think if you got that on Expedia or any other website, you'd be pretty happy with that. So again, we know that we're delivering the types of services people want. We also know that we're actually making the savings that we envisaged at the beginning. For me, again, in terms of prevention, you're not going to see those savings coming through right at the beginning of the project. I know a lot of people, if I was talking to my accountants back at the City Council, they'd expect to see the numbers in the boxes ticked off. Well, actually, I think the savings are going to be there over the years, and they're going to crank up as we move forward. But just the one example of learning disability pilot, 12,000 per individual. I mentioned reducing a 2,000 package to 1,000. You can work that out yourself for over a year. There's over £60,000 worth of savings in the most extreme areas where we've actually been able to make savings. In terms of service development, we've got a number kind of on the anvil. We've extended the contract with Tunstall for another year. I think one of the other things that's been really significant here is that we've actually developed a service that's right in the city. Although the responder centre is outside of Birmingham, we have a fairly significant team kind of managing, supporting and responding to concerns that people raise, both service users and their families, in the heart of the city. And I think it's always reassuring when people are able to talk to someone who understands kind of where they are in the city, what their needs are, and how they might kind of respond to the issues that they have. The other thing that I should mention is that we've actually just kicked off a telehealth pilot. In Birmingham, we have 3 clinical commissioning groups. We have one very, very large one, which is about 750,000 of the population. And they've actually kind of undertaken to work with us on a pilot. We're looking to invest around £1 million. And at the moment, we have somewhere in the region of about 31 GP practices signed up to actually kind of working with us around things like dementia and some of the long-term conditions, which again Birmingham has real issues with. So that's kind of some of the things that we're looking to do in the future. The other thing that kind of I think we need to be doing more of is engaging the third sector. I think in Birmingham we've got a fairly active third sector community and service deliverer. And although we do a lot of work with them and invest significant millions, I think there's still more work to do to raise awareness. And for me, again, it's getting into the heart of the communities, and that's where third sector are best, I think. They actually know their citizens, and I think working through them, rather than as a statutory organisation, I think would be far more successful. So that's some of the stuff that we're doing in Birmingham. We've made some progress, we've made significant progress, but obviously it's work in progress and there's still more to do. Thanks very much.
Thank you, John. Very interesting in terms of what's going on with Birmingham. Obviously, know that quite well.